Autoimmune diseases occur when the body's own immune system attacks self cells, and autoimmune diseases affect around 2 to 5% of the population, but there is an increase in incidence rates. Normally, we have immunological tolerances to our own tissues, as mechanisms are present to prevent immune reactions against self cells, such as deletion or inactivation of self-reactive lymphocytes. Because of this, we don't actually understand what goes wrong in autoimmune diseases. We don't know if it's a certain single mutation that compromises self-tolerance, or if it's a combination of inherited susceptible genes which emphasise this tolerance, as well as environmental factors such as infection or tissue injury. It can be diagnosed through things like MRI scans, lumbar punctures and neurological exams, and there are 3 main types that can be diagnosed: relapse remitting, secondary progressive and primary progressive. There are actually quite a few treatments for MS, the first being disease-modifying drugs, which are based off a couple different mechanisms. So there can be some drugs which reduce the inflammation and the immune response that's actually attacking the body, that's actually attacking the myelin. There's some drugs which act as a decoy for myelin so that the immune cells attack that instead. And there's also drugs which bind to the surface of lymphocytes in the blood, trapping them in the lymph glands and preventing them from crossing over into the central nervous system where they attack the nerve cells and myelin. You can also do short courses of high-dose steroids to help with symptom management. One example of an autoimmune disease is multiple sclerosis. This is an autoimmune disease that affects all ages, but most diagnoses are made between the ages of 20 to 40, and it usually affects 3 times as many women as men, and there are 100,000 diagnosed cases in the UK. MS is caused by immune cells which attack the myelin sheath of nerves within the brain and spinal cord. This exposes the nerve tissue, which can then be easily damaged, and slows down nerve impulses. The damage to the myelin sheath can be repaired, but it leaves lesions, which is where the term multiple sclerosis comes in, as there are multiple scars where this myelin sheath has been damaged or repaired. Because of this damage, the tissue is more likely to degenerate than the normal non-damaged tissue around it. This is usually gradual and takes place over decades, but it does cause degeneration.